Thank you very much. It's a pleasure to be here. My topic was an overview of survivorship research, and I think what you'll find is that it's a fairly new field that's really only been active in the last 15 years. And what I'm trying to do is give an overview to give you some ideas of where you can incorporate research along the way of the survivorship continuum. So I want to start today with a definition of cancer survivorship. This has been discussed many times, and what the final decision has been is that an individual is a cancer survivor from the time of diagnosis through the balance of his or her life. Family members, friends, and caregivers are also impacted by the survivorship experience and are therefore included in this definition, and I think you'll see as we go through why this is important. So really, why does survivorship matter? It has been estimated that in 2004 there were over 10 million cancer survivors in the United States, and this, as you can see from this curve, is growing rapidly. Therefore, it has become a very significant national health priority. The Office of Cancer Survivorship was established in 1996 by the National Cancer Institute, and it was designed in recognition of the large number of individuals now surviving cancer for such long periods of time. It's been dedicated to enhancing the length and quality of life in cancer survivors. So as you can see, this is a fairly new field. Some of the priority areas for the Office of Cancer Survivorship are to address the health and life of a person with a history of cancer beyond acute diagnosis and the treatment phase. And they're interested in expanding their research portfolio to cover two areas which I thought would be of particular importance to this group today. One is theory-based descriptive and analytic studies, but also intervention studies to prevent or to reduce adverse outcomes in these cancer survivors. And as you can see from this list of publications, it's also become a national public priority from several different realms. The President's Cancer Panel annual report in 2003-2004 focused strictly on cancer survivorship with an article called Living Beyond Cancer, Finding a New Balance. The Center for Disease Control and Prevention in 2006 put out a publication for a national plan for cancer survivorship to advance the public health strategies. And also the Institute of Medicine has put out three seminal reports since 2003, and a lot of my talk today is going to focus on these. In 2003, they looked at childhood cancer survivorship, 2006 in adult cancer survivorship, and in 2007, how do we implement care in these cancer survivors? Next, I want to start with a definition that I'm going to be using quite a bit throughout the rest of the talk, and it's called late effects of cancer treatment. So what are we talking about when we talk about late effects? These are unrecognized toxicities that are absent or subclinical at the end of therapy or become manifest later. So this does not usually happen during the acute phase of the actual cancer treatment, but something that can happen 5, 10, 20 years later. And the onset of these consequences of cancer is usually due to cancer and its treatment. When we think of late effects in general, what we think about is the multimodal therapy that most patients receive, which is chemotherapy, radiation, and surgery, and that there might be interactions between some of these modalities. But in reality, as we've been starting to do some of this research, what we've realized is that there's many other factors that need to be considered besides the multimodality. The age the patient is when they are treated, which you'll see throughout this talk, as well as males, females, genetics, socials, other lifestyles, healthy habits, those sorts of things. So what do we know about, I'm going to start with talking about survivorship in children and then go on to the adult. Most of the research that's been done to date has been in the childhood cancer arena. So what do we know about survivors of childhood cancer? The 5-year survival rate for childhood cancer is now 80%. Back in 1970, it was barely 50%. But because of these multimodal therapies, childhood cancer cure rates have been very successful. So we have estimated there are about 250,000 survivors of childhood cancer in the United States currently. But if you look at the adolescent young adult age group of the 20 to 34-year-olds, you can see that 1 in every 570 individuals in the United States is a childhood cancer survivor. And because of the cure rate at such a young age, what we also know is that the number of life years saved in childhood cancer is second only to breast cancer. So this is the Institute of Medicine report on childhood cancer survivorship. This is one of my favorite photos that I think that I've ever seen. And I've pulled out some of the recommendations that I would like to highlight today to give you some ideas of where research is and where it can go. Some of the guidelines in this IOM report were first to develop evidence-based clinical practice guidelines, to define a minimum set of standards for follow-up care, to improve awareness of late effects and the implications to long-term health, as well as to improve professional education and training regarding late effects and their management. So what kind of late effects do we actually see in childhood cancer survivors? You can see here that it's a large variety, and it's everything from quality of life issues such as growth or physical impairment, but also involves many organ systems, and several of these are very life-threatening, such as the development of a second cancer, as well as cardiotoxicity and pulmonary toxicity that we see in some of these individuals due to their treatment. Some of the most important information we received about childhood cancer survivors is through the Childhood Cancer Survivors Study. This is a National Cancer Institute initiative that began in 1994. The hypotheses for this study were all related to what were the late effects or sequelae of cancer treatment. It's a retrospective cohort study that involves 25 institutions in the United States and Canada. And at the time that this study was begun, there was about 20,000 childhood cancer survivors who were eligible to be part of this study. In order to be eligible, they had to have been diagnosed before their 21st birthday, diagnosed between 1970 and 1986. We began at 1970 because that's kind of the beginning of multimodal therapy. And they had to have survived at least 5 years from diagnosis, so we'd consider these long-term survivors. We collected data in two ways. First was through questionnaires. Individuals who were survivors who were over 18 at the time of contact, we sent a questionnaire directly to them. If they were under 18, we asked the parent to complete it. We were also fortunate enough to get a comparison population using siblings who filled out very similar questionnaires. We also had clinical data that came from the medical records, which is what made this retrospective. So we were able to collect cancer information, and one of the landmark features of the Childhood Cancer Survivor Study is the very specific cancer treatment information that we have, including exact doses of chemotherapy as well as radiation sites and radiation doses. This slide just kind of gives you a general idea of what the study population looks like. There were slightly more males than females in the survivor cohort. And at the time of the first survey, about a third of them were under the age of 18. And as you can see from this survey, and keep this in mind when I talk about some of these results, only 3% of these individuals were over the age of 40 at the time of the baseline. In the sibling population, we had about a little over 3,500 siblings, slightly more females than males in the sibling population, and the siblings were slightly older than the cancer survivors. So I want to talk about some of the seminal reports that have come out of the Childhood Cancer Survivor Study. I think we have close to 90 publications so far, but I want to highlight a couple of them that I think kind of give a good general overview of what these childhood cancer survivors look like as adults. The first thing, one of the reports that we did from the Journal of the American Medical Association is we wanted to look at overall domains in these individuals to get a good picture of their health status. And to do this, what we did is we looked at 6 domains. One was their perceived health, overall, how do you rate your health? Their mental health using the BSI to evaluate this. Functional impairments, impact on routine needs. Activity limitations, ability to walk around the block, climb stairs, that sort of thing. And for the survivors themselves, how they rated their cancer-related pain as well as their cancer-related anxiety and fears.